Medicare Advantage plans have a lot of moving parts, and when you add in insurance lingo and technical terms, things can get confusing fast. At Boomer Benefits, we often see people struggle to understand the difference between the deductibles on their Medicare Advantage plans and their plan's out-of-pocket maximum limit. So in today's video, I'm going to break down how these two parts work. A deductible is the amount of money you pay out of pocket for your healthcare expenses before your insurance begins to pay its share of the costs. In the world of Medicare, each part has its own deductible. Parts A, B, and D all have separate deductibles. But when you join a Medicare Advantage plan, you're getting your parts A, B, and usually D through the insurance company all rolled up together. This means your Medicare Advantage plan may include more than one deductible, such as one for inpatient and outpatient medical care and another for Part D prescriptions. On the medical care side, a Medicare Advantage plan can require a deductible upfront before it starts covering benefits for hospital and outpatient care. However, this isn't very common yet when you use the plan's in-network providers. More often, a deductible applies only if you use out-of-network providers. For example, you might sign up for a Medicare PPO with a $0 deductible for in-network care, but a $500 deductible for out-of-network services. When it comes to Medicare Part D, deductibles are more common even inside your Medicare Advantage plan. When you enroll in a Medicare Advantage prescription drug plan, the Part D plan that is built into that coverage follows the same 3 stages as standalone Part D drug plans. In 2025, plans can have a Part D deductible as high as $590. However, the deductible amount could be lower depending on the plan that you choose. For instance, if you enroll in a plan with a $300 Part D drug deductible, you'll pay the first $300 in covered expenses out of pocket when you're filling your prescriptions. After meeting this deductible, the plan coverage then kicks in, and you'll pay a copay or coinsurance for each drug based on its tier. In summary, when it comes to deductibles, your Medicare Advantage plan might have both a medical deductible and a drug deductible. Always check the plan's summary of benefits to understand what these deductibles are before you enroll in the plan. Now let's talk about the maximum out-of-pocket limit as it applies to Medicare Advantage plans. This limit is designed to protect you from spending beyond a set dollar amount on covered hospital and outpatient services in a given calendar year. Your Medicare Advantage plan can have various costs that you pay out of pocket, like deductibles, copays, and coinsurance that you pay when you receive covered healthcare services. The money you spend on these costs adds up throughout the year, and it counts toward the maximum out-of-pocket limit. If you reach that limit, the plan will pay 100% of your covered hospital and outpatient services for the remainder of the year. In 2025, the maximum out-of-pocket limit for in-network services can be as high as $93.50. However, many plans, especially the HMO plans in urban areas, often choose to set a lower limit because they are competing against other plans for your business. Let's look at an example. Here's the Medicare Advantage HMO plan in Fort Worth, Texas, based on information from Medicare's website. Looking at this, you can see that the plan has a 0 premium, which means that you pay nothing more for the plan than you are already paying for Part B. It has a 0 deductible for healthcare services, meaning there is no deductible that you have to pay up front for Part A and B services within the plan, which is great. However, on the Part D side of the plan, there is a $420 deductible that must be met before your prescription drug coverage kicks in. And finally, this plan has a $4,100 in-network out-of-pocket limit. This means that once your personal out-of-pocket spending on services like hospital stays, doctor visits, lab work, diagnostic imaging, physical therapy, cancer treatment reaches $4,100, the plan covers 100% of the costs for the rest of the year. Lastly, remember that your Part D drug spending, however, is separate from that and does not count toward the plan's overall maximum out-of-pocket limit. Instead, Part D has its own catastrophic coverage limit, which will be at $2,000 in 2025. Let's look at another example for a Medicare Advantage PPO plan that is offered here in Fort Worth. With PPO plans, you will often see 2 different maximum out-of-pocket limits. One for in-network health services and one if you are using both in and out-of-network healthcare services. Just like the HMO plan, the PPO plan has a zero premium, a zero deductible for health services, and a $420 Part D deductible. However, the in-network maximum out-of-pocket limit is higher at $6,700 for in-network services. However, this plan is a PPO, which means you have the option to seek treatment outside the network. So the plan must also provide a combined limit on your total spending when you are using both in and out-of-network providers. You can see here that the combined in and out-of-network maximum out-of-pocket limit is $10,100 for the calendar year. This means that if you go outside the network even once, you'll incur some additional costs, and you won't reach the maximum out-of-pocket until your combined in-network and out-of-network spending totals $10,100 in the calendar year. It's also worth mentioning that the costs and benefits of these plans can vary significantly depending on where you live. For example, Medicare Advantage plans in Florida often feature richer benefits, lower deductibles, and lower maximum out-of-pocket limits compared to plans in other parts of the country. Which Medicare terminology questions do you have? Drop them in the comments below, and we will be happy to answer. If you want to learn more about how Part D costs work, since they are in addition to what you spend on medical expenses within your Medicare Advantage plan, be sure to check out our video on how Part D plans work.